Hey everybody, I'm Armondo,
I'm Emma.
and we are the prevention specialists here at Careteam Family Health and Specialty Care in Conway, South Carolina. And today we are coming to talk to you about taking control of your sexual health in observance of National HIV and AIDS Awareness Day for the youth, which is actually on April 10th, which is tomorrow. But we're coming to you live on this lovely Friday to just talk about different methods, stigma that's associated, and just the importance of getting help tested as well as getting on PrEP. So I hope you enjoy, and if you have any questions, we'll save at least 15 to 20 minutes after we present our information for questions, feedback, anything that you have. If we don't know, we'll message you later after this live and get your question answered. So I'll start with just a little information on HIV. HIV, or medically known or clinically known, is human immunodeficiency virus. It's a virus that attacks the body's immune system, and if not treated, it can eventually lead to AIDS. And AIDS is the last and final step, which is irreversible when it gets to that point. There's currently no effective cure for AIDS or HIV. However, there is medicine that can contain or control it, although it's not curable. Most people get HIV through anal or vaginal unprotected sex, sharing needles, or sharing needles for drug equipment, and typically mothers to babies. However, some other common transmissions of HIV will be through oral sex. It's a small percentage, but it's still a percentage of getting HIV. The different stages of HIV, the first stage will be acute, which is the most contagious infection stage, which means that it's most transmittable at its highest potential. The second stage will be chronic HIV infection, which the virus is in your body for a period of time, but it still can be transmitted, but it reduces at a lower rate as it has been in the body as long. And the third and final stage, as I said earlier, will be the stage of AIDS. This is when the viral load drops below 200, and it is easily transmittable to the next person. And once you get to this stage, it does not revert back to HIV. It will always be classified as having AIDS. From what we've heard, there may be some change about that, but it is not right now. It's just you'll be classified as having AIDS. Other STIs that are sexually transmitted outside of HIV are commonly known. They're the common chlamydia, gonorrhea, trichomoniasis, genital warts, genital herpes, pubic lice, scabies, and syphilis. We here at Careteam, we cover 3 counties, Williamsburg, Horry, and Georgetown counties, and typically we see most common STIs in gonorrhea, syphilis, and chlamydia. So I was solely focused on those 3 and just giving information about the transmission and how getting tested. We'll later talk about getting tested, but just the transmission and myths that are typically associated with these STIs. So as I said, the first STI will be chlamydia. Chlamydia is a bacterial infection that is passed through unprotected sex without a condom, and is particularly common in most sexually active teenagers and young adults. And since this is observance for National Youth HIV and AIDS Awareness, we really want to point out the importance of coming in to get it tested for these STIs that we will talk about. The bacteria usually is spread through sex or contact with an infected genital through semen or vaginal fluids. Your genitals coming in contact with a partner that may be exposed means that you can get chlamydia from this, even if there is no penetration, orgasm, or ejaculation. It is still a possibility to become infected with chlamydia. If you do have chlamydia, some of the signs and symptoms that you may experience are pain when peeing, unusual discharge from the vagina, penis, or your bottom, anus, which we medically call it. In women, pain in the tummy, bleeding after sex, or bleeding between periods is common. And in men, pain and swelling in your testicles. The next STI that I'll talk about is gonorrhea. Gonorrhea is also a bacterial infection that is mainly found in the discharge of the penis and in the vagina fluid. The bacteria can infect the entrance of the womb, which is the cervix, the tube that passes urine out of the body, the urethra, the rectum, and less commonly, the throat and eye. Most STIs can infect what we call the pink parts or the fleshy parts of your body, which are like the inside of your eyes, the inside of the mouth, the inside of the vagina. Those pink fleshy parts that are most susceptible to becoming infected with any type of virus, bacteria that can cause a reaction in a negative or a positive way. So we do ask that you, well, don't ask, but we do recommend using protection when it comes to sexual engagement. Our third, excuse me, our third STI that we will talk about is syphilis. As the other two are bacterial infections, this is also a bacterial infection. And syphilis is the most common one that we see in the counties that we cover, being that syphilis is not always going to show a symptom. You can have syphilis and don't know it because there's no symptoms, there's no discharge, there's no irritation when you're urinating, there's no burning or scratching, so you have no way to know except by coming to get tested. But if you do have symptoms for syphilis, they may come in small, painless sores or ulcers that typically appear on the penis, vagina, or around the anus, but can occur in other places such as the mouth. A blotchy red rash that can affect the palms of the hands and soles of the feet. A small skin growth similar to genital warts that may develop in the vulva in women and around the bottom of the anus in both men and women. White patches on the mouth, which is typically called thrush, I believe. Thrush. And tightness, headaches, joint pains, a high temperature, swollen glands in your neck, groin, and armpits. If left untreated, syphilis can lie dormant in the body for years and can spread to the brain and other parts of the body and cause serious long-term damage in the future. As I said, symptoms do not always come with syphilis, so the only way to know is coming to get tested, as well as every other STI, sexual transmitted disease, or HIV. Most common STIs can be treated with antibiotics, except HIV. HIV you will have for the rest of your life, being that it is a blood disease, and so being that the body is made mostly of blood, it will always be there. However, it cannot be cured, but it can be contained and controlled through medicine. And we have all types of medicine here that we prescribe that will bring you down to that undetectable level, which means the virus cannot be transmitted to the next person. And yeah, myths around STIs and HIV. STIs cannot be passed through casual contact such as kissing and hugging. It also cannot be from sharing bath towels, sitting on the same bath sheets, sitting on the same toilet, swimming pools, and eating or using the same utensils to eat as somebody who is infected. So these are myths that commonly are told about HIV. You cannot get it from touching something that somebody else touched or come in contact. Because it is a blood disease, you have to exchange blood or sexual fluids with the next person in order to contract the HIV. So these are just some common myths that are around the modes of transmission for HIV and other STIs, as well as a little background about the STIs. And now Emma will be coming to talk to you about stigmas that are associated with HIV and what else? HIV.
Stigmas around HIV. Hi guys. So I'm here to talk about stigma. And stigma is a negative attitude towards people who are living with HIV. For example, believing that somebody deserves it deserves having HIV for the actions that they've done in their lives, feeling that it only affects a certain group of people, making moral judgments about how they got it or how the HIV virus was transmitted. So stigma is something that we really need to help stop, and it's kind of based on a discrimination. So stigma is the attitude. Attitudes lead to discrimination, right? So discrimination would be like a healthcare provider refusing treatment because that person has HIV, or refusing casual contact because somebody has HIV. Socially isolating people who have HIV and treating them different, like they are contagious, like I can get it from you just being around you. We know that's not true. We know now that that's not true. So these stigmas and discriminations come from an antiquated thought process. In 1980, when we first learned about this virus, we didn't know how it was contracted. we thought it was only gay people or gay men who were getting this virus. We know now that's not true. We know that you can't get it from touching somebody, from hugging somebody, from kissing somebody, from any of that. So those stigmas that we had put in place back in the 80s are no longer relevant today. So what can we do to stop stigma? We can educate ourselves and we can talk about HIV, right? We need to talk about HIV. We need to let people know that this virus is not killing anybody. It is, people are living long lives. They are still able to have children. They are still able to do everything that somebody who is living without HIV can do. So in order to do that, educate, educate, educate. Learn as much as you can. Go to the CDC website. Go to DHEC's website. Learn what you can about HIV and the way it's transmitted, and spread that education to your friends and family.
And also, after spreading that education to your friends and family, engaging in conversations with your partner about statuses and about disclosure, having full, honest, and disclosure in a communication channel with your partner or anybody that you're engaging in sex with. Just some tips about discussing. You always want to ask questions that are like, do you have anything I should worry about? Don't do it in a rude way, just in a respectable way, because you don't want to offend anybody who may happen to live with HIV, because some terms that we use can become offensive, like, are you dirty, or do you have anything that I can't get rid of, or, you know, stuff surrounded like that. So ask questions like, when was the last time you got tested, or have you been tested recently? What was the results of your test? Stuff like that can easily open channels of communication, as well as this disclosure and honesty. Getting into those, I guess, the secrets, if you want to say, is also a good thing. You just have to know how to bring up that level of communication. Prevention is also a big part of sexual health. We all know what a condom is, or we should know what a condom is, or how to use a condom. If we don't, it's easy. You just open up a condom, sit it on the penis if you are a male, like a sombrero, roll it down to the bottom of the shaft, and leave a little room at the top for the fluid that you'll release after you are finished. And once you take it off, you roll it up tight, dispose of it. Not in a toilet, not in a paper bag. You wrap it up, tie it up, and you dispose of it in a garbage can. Other prevention methods besides condoms, we have dental dams. Dental dams are just thin sheets of latex that you place over the penis or vagina if you want to perform oral sex on someone. That is a prevention for the mouth, that you don't get any ulcers, any thrush, any sores around the mouth or inside the mouth. That's just a preventative method that is offered, that we have here outside of condoms. We also have some enhancement toys as well that can be used for prevention, but not technically solely for prevention. However, they can enhance and just spice it up, spark it up. That's all about sexual health as well. And as I said, just having that level of communication with your partner, as well as expanding your education, keeping up with the stats in your age group from the CDC around any type of STD, whether that's syphilis, gonorrhea, chlamydia, HIV. Just having the knowledge that and the understanding of this is a disease, is serious. Anybody can take it. As she says, going back to the stigma, it's just not a gay man's disease or a gay person disease. Anybody who is engaging in unprotected sex is able to contract HIV, STDs that they can and can't get rid of. As I said, both common STDs and STIs can be treated through medicine and antibiotics. However, HIV is not one that can be treated. It can be controlled, but not cured. As well as just like expanding your network around sexual health, going to clinics, going to webinars. All this information is out there to expand our knowledge, and it's just a click away. So just finding those tools and those outlets, those media, social kits, following us when we do express or promote an event such as today in observance of National HIV and AIDS Awareness. Just logging in and hearing what we have to say, that's expanding your knowledge, as well as opening those lines of communication for the sexual health. And also just taking control, just being in control of your sexual health, because you as a person have to say, this is my life, I have to be right for myself, because health is wealth, and if I'm not healthy, how can I help somebody else if I'm not at my best? So just using those same tools and tips that we are giving you for others, use for yourself. Making sure that you have condoms. Make sure your condoms are up to date. Making sure that, just 1 second. Sorry about that if anything happened. Just making sure those condoms are up to date, as well as not expired. Just making sure lube, you're using lube for the friction. Just taking those materials that we have that are out there to promote health and sexual health are being used, especially in the youth, because youth accounts for a majority of the STIs and the HIV rates. In 2018, the CDC reported that youth aged 13 to 24 made up 21% of the new HIV infections in the United States. And the total number of new cases in 2018 was 37,832. That's a lot accounting for the youth. And in youth, we do know that, we do see that sometimes when youth are diagnosed with HIV, they don't seek out treatment right then and there. And that's a problem that we see, because if you're not getting treatment, you're not suppressing that viral load. And suppressing that viral load, as I said earlier, is becoming undetectable, not transmitting that disease to anybody else that you come in contact with sexually, especially if you are having unprotected sex and you don't know your status. Because the only way to officially know if you have any of these diseases are to come and get tested. And if you aren't getting tested, we don't know. And we have not because we ask not. So just coming in to getting tested is taking a closer step to promoting health and ending the epidemic of HIV and AIDS that has been around since 1981, where the first case was seen in 5 white men in California. Just coming in to getting tested. And now we'll just talk about the testing period, because that's the only way to know. And technology has expanded HIV in so many ways. You no longer have to wait 5 days for a result for a blood draw. We now have what we call rapid HIV tests, and we do rapid HIV tests here at Careteam. So one test is 20 minutes and one test is 60 seconds. And both of these effective tests will detect HIV if you have it. You get same-day results, and we'll take it from there, yielding the result, whether it's negative or positive, promoting good health, keeping your condoms stocked, keeping them out of the heat so they don't dry up, become brittle and unusable, and as well as getting the positive results, just getting you into treatment so you can get that viral load to that suppression status.
All right, so like he said, testing. The CDC recommends anyone from the age of 13 to 64 to be tested at least once. Mm-hmm. So for those of you watching and those of you that may watch later, do you know your status? Because we need to promote this. We need to make sure that everyone, including our youth, need to be tested. Like he said, youth made up 21% of the HIV cases in 2018. We know our young people are out there, and we know they're having sex. And we also know that a lot of times it's not being talked about in the family. It's not being talked about in the schools. And they're learning what they learn from their friends. And that's not always great information. So using condoms protects you from the HIV, from STIs. Knowing these things is power. Knowledge is always powerful. So if you sometimes have condomless sex, or you have multiple partners, if you've had an STD in the last 6 months, we may be able to help you, because there is now a drug called PrEP on the market, and it is a post-exposure prophylactics. And what it does is it is for people who are at high risk for contracting HIV, but are HIV negative.
Only for the negative.
Only for the negative. So if you are HIV negative and you engage in any risk behaviors, condomless sex, drug use, multiple partners, you've contracted an STD, then this drug may be right for you. It's one pill once a day, and it protects you from HIV. It doesn't protect you from other STIs. You will still have to wear a condom. And of course, it doesn't protect you from pregnancy. But it protects you from the scary one that nobody wants to talk about, HIV. So insurance is not a problem. This can be very low cost or even free. You come in, you have an HIV test, you talk to one of our doctors, and you can be put on it that day, right? So testing. And if you fall into a category where you think that you might put yourself at risk, nobody wants to contract HIV. We want to end the epidemic. We want everybody to be educated. We want everybody to know their status. So help us, help you to do that.
By coming in to get tested, we test here at Careteam Monday through Thursdays from the time of 12 to 4 p.m. We don't take appointments. You can just walk in and see myself to get tested. And Emma, shortly, she is going through her certification stage, so she'll be able to test soon. But if not, but while we wait, if you want to test, you can come to Careteam, see myself, and I will get you the information you need. We will get you tested, and we will get you on PrEP if that is something that you are willing and ready to start. But about PrEP, as she said, it's only for those who have a negative status of HIV. If you become positive, you cannot take PrEP. PrEP is also, it goes by 3 months, so you have to come in every 3 months to get tested to make sure you are still at that status of negative to continue your PrEP regimen. It also, going back to testing, if high risk, being high risk or engaging in unprotected sex, it's required that you get tested every 3 months because that is what we call a window period or a time from an exposure to the infection where it becomes able to pick up in the test for the rapid. So 3 months, if you engage in sex and you do wear condoms, you can do it annually, biannually, whatever you choose. But if you are one who engages in those high-risk activities like unprotected sex with multiple partners, it is expected that you come and get routinely tested every 3 months just to ensure that you are in good health. So if you have any questions about any of the information that was shared today with youth and HIV, the transmission, the myths, the stigma, other options, we will be here taking any questions that you have for a few moments that we have left, or any other information. If you have any questions that we did not touch on, we will we answer those. And just about testing is free and anonymous. It's solely confidential. Nobody outside of myself would have access to that information or the conversation because it is confidential, and we want everybody to feel empowered. And Careteam is located at 100 Professional Park Circle here in Conway, South Carolina. That is the zip code 29526. Again, 100 Professional Park Drive, Conway, South Carolina 29526. And we also will hopefully be back testing at CCU soon, which is the college located right down the road from us, providing these free methods of prevention as well as free access to your sexual health. And if you want to come to us now, you can have that. You have that ability and accessibility because, as I said, I'm always here and I'm ready to help you, help me, help you. So, as I said, if you have any questions, we'll stick around for a few moments and just answer them. But if not, I hope you take something away from this conversation and also addressing the youth and just helping. If you know of any youth who may need our services, send them our way. We would definitely help them and get them pointed sent in the right direction.
And also, once we start getting back out in the community and stuff, if you see us out there, come over, talk to us, ask us the questions that you may not want to come into a medical building and ask. We'll be happy to share any information with you. We know that this can be a scary thing, but if you are young and you are out there and you are having sex without condoms and with multiple partners, this is something that you need to take care of. You need to empower yourself and your sexual health. So come see us. If you see us out and about, come see us. Come see us at Careteam in Conway. Come see us. Come talk to us. We'll answer any of the questions that you may not want to ask on Facebook.
And if you don't want to come into here, if you don't want anybody to know, we do have testing events in the community that are posted on our social media pages. You can come there in those disclosed locations and get tested as well, or get the treatment that you need. And parents, encourage your kids to get tested who are engaged in those sexual relations, because you know kids won't always be kids and they do experiment. So just have that open line of communication with your kids and express to them that this is what it is, and these are the methods that we have set. Encourage them to get tested. Just have that open channel of communication, that honesty, because we want to end the epidemic. It needs to be ended. So as I said, we'll stick around for any questions that you may have. Once again, my name is Armondo, and I am fully vaccinated, so this is my face. This is how I look behind the mask. So
I will be in a few days. I've had my second shot.
So yes, please come and see us, talk to us about anything sexually related that you may a concern or not. If you just want information, we will help you. Thanks for tuning in. I hope you take something away from this webinar. And if you have any questions, you can message us in the off the page. Just go to Careteam Plus on Facebook, and you can send us a direct message. It will come directly to us, and we will have that. We will get that information for you. And if not, if you want to call me at my direct line, my name is Armondo. My direct line is 843-234-8242. Again, that is 843-234-8242.
And we'll put that information in the comments once we end the live feed, so that it'll be there for you in case you weren't able to write it down or catch the address. My battery's getting ready to die.
It is. Well, if we don't have any questions, again, you can post those questions in the message box or in the comment box, and we will answer those questions for you as soon as we get that information. Hope you had a great day, and enjoy your weekend. Bye.
Bye.